Arrgh! Ahoy, mateys! Alright, what's up with the pirate hat? Stay tuned and you'll find out. Okay, so today we're going to talk about pros and cons of vaccines, and we're going to talk about the side effects of them. So, in the last video we talked about how vaccines work. If you haven't checked that out, go check that out first so this video makes more sense. Okay, so to understand why so many healthcare professionals are huge proponents of vaccines, we need to understand something called herd immunity. And all that means is that the group as a whole if they are immune to a particular disease, then they can't pass it on to everyone. They can't pass it on to people within their group, and as a result, the whole group doesn't get sick. Or people within that group don't get sick. Okay, how does this go with vaccines? Well, there are some people who have really bad immune systems, right? Whether it's because their immune system is poor because they're elderly, or because they're children, or because they were born with just a weak immune system, or if they're cancer patients, HIV patients. There's a million different reasons that someone could have a poor immune system. And someone with a poor immune system can't clear an infection. And what I mean by clearing is if they get sick from it, their body can't get rid of it properly in the way it should. And sometimes these people get really sick from that. So what does this have to do with vaccines? Well, something like the flu virus, which we're going to talk about at the end. The flu virus, a lot of people, healthy adults in particular, can get the flu virus. They get sick with it, and it lasts for about a week, and then they clear it on their own, and it's not a problem. However, with every single infection, there's something called an infectious period. And all that means is from the time that you were first exposed to it until the time it's out of your body, there's a potential for you to pass that infection on to other people, right? So sometimes that's days, sometimes that's weeks, and unfortunately, sometimes that can also be months. Well, why is this important? Because, like I just said, people who have really weak immune systems, they're counting on other people to not pass that infection on to them because they can't clear it as well as you or I can, right? So what we do with vaccines is we give somebody that protective immunity ahead of time so that if they get exposed to something like measles, mumps, rubella, or whatever, then they can't pass it on to other people who aren't able to get the vaccine or who don't have good immune systems, who can't clear it by themselves. So what does this have to do with anything? Well, when we're talking about vaccines, we talk about how many people like them, and the vast majority of healthcare professionals are all for vaccines and trying to get everyone to make that happen, right? Well, there are side effects with vaccines. There are side effects with anything, right? But the side effect profile of vaccines are extremely small. But the main thing that people are concerned about when they look at vaccines is they're concerned with what's in the vaccine. So if I give someone an antibody to tetanus, am I giving them tetanus? No, definitely not. However, there are other things that we put in the vaccine in order to stabilize it and make that vaccine better and to make sure that it lasts long enough. And those are typically what people are concerned about. But in order to understand that, we need to talk about something called toxicology. Just real quick. Toxicology is just the study of how bad things can be in the body, right? And the concentration of things, concentration of chemicals. So the father of toxicology was this guy named Paracelsus who lived back in the 1500s. This guy was really smart. And he said the dose determines the poison. And all that means is that anything, absolutely anything can be a poison. It just, what determines whether or not it's a poison is determined by how much is actually in the body. Case in point, a glass of water, right? That's really healthy for me. We all need to drink water. That's really good for me. That's fine. That's not a poison. However, a gallon of water, if I drink like 10 gallons of water, I could get something called water intoxication and I could die from it. And it actually happens, especially with like marathon runners or something like that when they only drink water. So anything can be a poison. So when we talk about vaccines and we talk about the other chemicals that are in a vaccine that people are often concerned about and they don't quite understand what's going on, look at the toxicology of it and look at the concentration of what's actually in there. So if it's something like formaldehyde, right? Formaldehyde is just something that stabilizes and just kind of preserves it a little bit. Well, why is that important? Because bacteria and viruses break down so quickly that if we didn't put a little bit of something in there to stabilize it, then the vaccine would be useless. And then yet again, we wouldn't have herd immunity and everybody would get sick from these preventable diseases. So why the pirate hat? Glad you asked. Lemons. Limes. What does this have to do with anything? Well, pirates and other sailors back in the 18th, 17th century, they used to suffer from something called scurvy, okay? And scurvy is just a deficiency in vitamin C, hence the lemons and limes. When they started bringing fruits aboard, they started eating these lemons and limes, and they didn't have scurvy anymore. When we make vaccines, we actually do something very similar to that. The vitamin C that's in a lime or a lemon or orange or anything else like that is actually an acid. It's called ascorbic acid. And on its own, in small doses, it's okay. But ascorbic acid on a large scale can actually be very bad for you because of how acidic it is and how toxic it can be to you. So how do we do this, right? Is lemonade and orange juice bad for you? No, it's good for you. But like we said, we don't want to have high amounts of that in our body, right? Or if we do have high amounts of it, we add other things to kind of tone it down. Well, what are some other things that we tone it down with? Well, when life gives you lemons, you make lemonade, right? So we add sugar to it, right? Something to just kind of tone the acidity down a bit, and then we add the water, okay? And we ultimately dilute that vitamin C. Well, with vaccines, we're doing that same thing. So when you think of formaldehyde or anything else that could potentially be in a vaccine, think of the vitamin C in here. So we might add a tiny little bit of like formaldehyde or something to stabilize it and kind of keep that bacteria so it's actually effective, and that vaccine is so it's actually effective. But we do it in such small quantities, and we dilute it with a bunch of other stuff so that the body can still use it, but it doesn't hurt the body. So that's what you need to look at when you look at vaccines, is not just the tiny little things that are in there, but rather the amount of them compared to the amount that's actually detrimental to the body. Okay, so ultimately with vaccines, the last thing we need to talk about real quick as an example is the flu vaccine. Okay, the flu vaccine is something specific because the flu vaccine, in order to understand this, I need to put on a jacket. The flu vaccine is unique because, like my camouflage jacket, it is the master of disguise. The flu vaccine, or the flu virus rather, constantly changes. It's changing every single year. And as a result, we can't give the same vaccine that we gave last year or 5 years ago or 10 years ago because it's always trying to hide out and do something different. So if it's trying to do something different every single day, well, how do we even make vaccines to it? Why are these vaccines even used if it's just going to be different next year? Well, the reason we do that is exactly what we talked about in the beginning, called this herd immunity. People who have poor immune systems, we can pass the flu on to them. And because the flu is still a very prominent killer in today's society, millions of people still die from the flu every single year. What we want to do is we want to give people the vaccine so that they can ultimately stop passing the flu on to other people who have weaker immune systems. So why the camouflage? Well, like I said, the flu virus constantly changes. And every spring, a group of really qualified and extremely intelligent researchers get together and they say, okay, look, we're going to look at all this historical data, all this information, and at the end, we're going to make an educated guess. But yes, the flu vaccine is a total guess. And as a result, that's why you may see that sometimes the flu vaccine doesn't work as well as we hoped it to. Does that mean it doesn't work at all? No, actually, having the best guess is still much better than having no guess at all, right? If you were immune compromised, like if you were a cancer patient or if you were someone who had a weak immune system, you would want everyone else to at least try to make sure that they would have the vaccine and what's necessary so that they don't pass that on to you because your body can't clear it. People with strong immune systems, like what we call immune competent adults in particular, well, they can clear the virus and get rid of it, but people who have weak immune systems can't. So they are counting on people with strong immune systems to not pass it on to them, and we do this with the vaccine. So ultimately, the pros and cons of vaccines and the side effects, what we talked about, the whole point of it is this herd immunity. That's what we want to do, is to protect the people who can't protect themselves. That's what we do with vaccines, and to get rid of these preventable diseases. Polio is a great example. It used to be very rampant and still is rampant in different parts of the world. However, due to vaccines, we don't have it really in the States. Measles is another one that used to be completely eradicated until, as I'm sure you've heard, just recently, and now that's an issue as well. So with vaccines, when you think of these chemicals, right, these that you may see in a vaccine, think of the lemon, okay, and think of the concentration of it. And when you think of the flu vaccine, think of the camouflage and how it's constantly changing. And that's ultimately what determines how we can be vaccinated in the future, is looking at the past data and everything else like that, and determining the best possible best possible option for the future for vaccinations. So thanks a lot for checking out this video. Like us on Facebook, Simple Medicine KIP. KIP stands for Knowledge is Power. And also subscribe to our YouTube channel if you want. All right, thanks a lot. Have a good one.